Hi, I'm Dr. Jeffrey Albaugh, and I'm an advanced practice urology clinical nurse specialist. I run the sexual health clinic at both the Jesse Brown VA Medical Center and at North Shore Urology at Glenbrook Hospital. Now there's 5 categories of treatments for erectile dysfunction. We're going to discuss each one now. All medical and surgical treatments have risks and benefits, good and bad effects in the body. More invasive treatments tend to have a few more risks and side effects. So let's talk about these specific treatments. Probably the most popular treatment for erectile dysfunction is oral pills. Oral medications for erectile dysfunction include things like sildenafil, also called Viagra, tadalafil, also called Cialis, and vardenafil, also called Levitra. These medications all work to block an enzyme in your penis so that there's more chemicals in the penis to allow smooth muscle to relax and blood vessels to dilate. On average, any of the 3 drugs take about an hour to begin working. Unfortunately, failure rates with these oral agents after prostate surgery has been reported as high as 88% in the period after surgery. So many men don't have the full effect and benefits of these drugs. But they eventually may begin working as the nerves recover and your erections start coming back. Remember, as I said earlier, it can take 2 years for your nerves to recover after surgery. Oral pills do not always work for men after prostate surgery, even after the nerve has recovered, because they rely on nervous conduction to be effective in your body, and if the nerve is not fully functioning, the pill may not work. The advantage to oral pills is that they're easy and they're discreet. Men like taking these medications because they're simple. The disadvantage to the oral medications is that not everybody can take them, and they do not work for some men after prostate cancer surgery and treatment. Now I'd like to discuss the non-invasive treatment, including the vacuum constriction device, as well as venous tension loops to help hold erections during sex. So for those unwilling or unable to use any form of medications or prescription-type medicines to help improve erectile function, this treatment is probably a good choice. The vacuum constriction device, or the vacuum pump, creates an erection by forcing blood into the penis after creating a vacuum seal around the penis. The penis is slipped into the cylinder, and when you start to pump, or the pump is activated, suction occurs, and that pulls blood into the penis. Now, that blood in the penis with the vacuum seal will maintain until that vacuum seal is broken. A rubber ring, as you see, I preloaded this ring on the device, goes around the base of the device, and when the penis is inside, after it becomes hard, you will flip the band back onto the penis, release the suction, and the band will go on your penis as it is erect. The tension ring is only used to maintain the erection during sex and cannot be worn for more than 30 minutes at a time maximum. Do not use the tension ring during daily penile rehabilitation, since the goal of penile rehabilitation is to promote blood flow in and out of the penis, and the ring traps the blood in the penis. The advantages to the vacuum device are that it works for almost all men, and it is non-invasive. You're not taking any medications. The disadvantages are that you have to be trained properly because it can be a little tricky at first. You must wear a ring to maintain your erection. The erections will not maintain without the ring, and it can be cumbersome. But with proper training, the device has a great success rate. Now I'd like to move on to MUSE. MUSE stands for Medicated Urethral Suppository for Erections, and it's a medicated pellet about half the size of a grain of rice that is inserted into the urethral meatus. The urethral meatus is the hole at the tip of your penis where the urine comes out. Using this disposable plastic applicator to put the MUSE in, this drug travels across the urethra into the penis to directly dilate the blood vessels of the penis. Now, an erection typically occurs within 5 to 15 minutes after insertion of the pellet and can last for 30 to 60 minutes. You simply drop the device into your hand. Inside the device is the small medication in the tip. You put this down into your penis. It goes in this far. You push the button to release the pellet down into your urethra. You take the device out, leaving the pellet inside the urethra, and roll your urethra between your penis between your hands to dissolve the medication inside the urethra. The medication will dissolve in there, travel across to your penis, and dilate the blood vessels. About 40% of the men have reported successfully achieving erections sufficient for penetrative sex after using this drug. The advantage to mousse is that it's very easy to instill right after you urinate so the urethra is wet. It doesn't usually require a ring around the base of the penis to sustain that erection. Now, the disadvantages to mousse is that it does not work for every man. Remember, its success rate is about 40 to 50%. It is expensive and it has some side effects. Your healthcare provider will need to work with you to find the right dose of mousse and make sure that you do not have any problematic side effects. Penile injections are another treatment option. Now, the widely available injections that you can get from your local pharmacy are either Caverject or Edex. They use that same drug as mousse pellets, but now the drug is delivered more efficiently through a needle directly inserted into the tissue of the penis. It's a very small, fine needle I'm going to show you now. Very small, very fine, diabetic type needle that is inserted. It's only about a half an inch long, and so it's inserted into the base of the penis, not down by the head, but towards the base of the penis. And the FDA-approved medications that are made for each individual man, Edex and Caverject, are available in your pharmacy. There's also other compounded non-FDA-approved medications that are made for each individual man at a special compounding pharmacy. These medications include prostaglandin, Bimix, Trimix, and Quadmix. It takes about 5 to 15 minutes for these injections to start to work in your penis, and the erection lasts for approximately 30 to 90 minutes. As I showed you before, the needle is thin and fine, and studies have shown that men report low amounts of pain with needle injections. The advantages to injections are that they have a good success rate with producing an erection rigid enough for sex, and you don't have to wear a tension ring around the base of the penis during sexual relations. But the disadvantages are that you do have to self-inject the penis each time you want to have sex. They're expensive, and there are some side effects. Injections are more invasive and should only be done after detailed instruction and a trial with a qualified healthcare professional. Now I'll move on to the final surgical option for erectile dysfunction. This involves insertion of the penile implant. There are two types of implants. There is a malleable implant, which is always semi-erect, and there's an inflatable implant. Cylinders are placed in the penis with either implant, and the cylinders will make your penis hard. The malleable implant is simply a semi-hard cylinder placed into the penis to make it hard enough for sex. But the inflatable implant has a pump that is surgically placed in the scrotum next to the testicles, and that can be used to inflate and deflate the cylinders within the penis. Surgery is permanent. Even if you have the implant removed from the penis, the surgery will permanently damage the tissue of the penis. The great advantages to surgery is that it is a treatment that works when other medical treatments have failed. But the disadvantages are that there are risks with any surgery, all the surgical risks that come with surgery, and there can be some side effects. Note that surgical procedure may not be an option for all men who are not considered to be good candidates for surgery because of other health reasons. We've now reviewed 5 categories of treatments for erectile dysfunction. from least invasive being the vacuum constriction device, to the oral pills Viagra, Levitra, and Cialis, to the Muse urethral pellet, to the penile injections, to the penile implant surgery. All these options have advantages and disadvantages and must be considered carefully with your healthcare provider. Recent research has shown that early intervention with regular use of some of these treatments like the vacuum device, the oral pills, Muse, and the penile injections may actually help with return of a man's own erectile function. Deciding on treatment for penile rehab or to treat erectile dysfunction after prostate cancer treatment can be challenging and daunting. There's some things you may never want to do, or you may never be willing to do. Any treatment can be necessary or may help you regain function, but you have to decide what's right for you. The most important thing is that you sit down with your healthcare provider to make an informed choice of what is the right treatment for you.